welcome. My name is Melissa Hughes, and I'm the Business Solutions Director at Workplace Options Canada. On today's episode, we'll be discussing the topic of providing mental health support for on-site and remote workers. I'm pleased to be joined by a very special guest, Mary Lou Sagrid. Mary Lou is the Mental Wellness Coordinator at the JFJB Fluor joint project between JGC Corporation and Fluor Corporation. She has 30 years of professional experience working in the field of mental health and has worked closely with first responders, providing training on understanding and engaging with persons with mental illness. Mary Lou, welcome. Thanks for being here today.
Thank you so much for the invitation.
Mary Lou, in your current position, you manage creating mental health and wellness programs in camp settings. What are some of the physical and mental stressors that on-site and remote workers face that you've seen from your experience?
Well, there's a variety of things. We often start with talking about the fact that we're away from families. We're away from our main support system, so there's some risk of isolation. The fact that lots of times changing our habits, our social groups, our volunteers, our friend group, all of those things, long hours, long distance travel. On our site here, we have people from over 209 countries, so sometimes some extensive travel and for some of us that are more what we consider local, within Canada, United States, we do a 14 and 7 rotation. So we get home every 14 days, but people from other countries are sometimes here for 2 or 3 months before they're able to go home. Communal living. Sometimes it's great and sometimes it's really tough if you have a neighbor that snores or, standing in line for food or, going for the washing machine and it's busy yet again can increase our stress levels. Here in Kitimat, where there's a factor, we've gone through periods. My last rotation here was 21 days and I saw the sun all of 2 hours while I was here. And so it's beautiful when it's sunny, but when that rain stalks in, it can be a lot. It can weigh heavy on all of us. Sure. And then there's those worries and concerns about what's going on at home. If we're struggling in our relationships or our children are struggling, and we sometimes feel a sense of helplessness if we're away from home. And, construction, remote work it's a challenging career. It comes with lots of rewards. It comes with that nice big paycheck, but oftentimes it comes at a price.
I can imagine. What are some of the consequences do you find of the stressors in the workplace, or of these stressors rather?
There's lots of common themes that we see. Sometimes there's breakdown of relationships. There's actually a high divorce rate within the industry. Oftentimes we see for physical pain, chronic pain. We see poor physical health. There's a bit of a standing joke on site. When you come here, you either bulk up or bulk out. So, you're either at the gym all the time and you get really fit, or you're often, it's kind of nice, I have to say, as a mom and a wife, coming here and not having to do the grocery shopping and do the cooking and all that is a nice break for me. But it also runs the risk if we're not very mindful in how we're eating, the foods that we're choosing, we can end up with poor health because of that. Fatigue, sleep is something that is oftentimes, again, that communal living. I live in a small, I think it's not very good with distances. I'd say maybe about an 8 by 10 room. And I've got neighbors and doors slamming, and just that change, even something as simple as not sleeping beside my husband every night was a bit of a challenge for me to get used to. So you learn the tricks sometimes to help manage that as well. But we also see, negative thinking patterns. Sometimes we see short tempers, challenges from becoming distracted if we're unable to keep our minds on task. All of those things become overwhelming and become factors that we are trying to, I refer to them as those risk factors that we need to implement those protectorate factors with. And that's part of it. I think the job of the team here to do that is to instill some of those protectorate factors to offset the risks.
Yes, and when I was on site visiting you, I was so impressed with the tools that are in place to support employees, but I can see how the long days and the time away from family and community could really impact whether or not you use those wellness tools that are available.
Yeah. And some of it is a culture shift. And I think that's one of the things that we're really working on here is changing the culture within the industry. This is still very much a male dominated industry.
Mm-hmm.
So there is still a little bit of the old idea that we don't talk about mental health, that you suck it up, stuff it down. And we're seeing that change. We're seeing more and more people reach out for the services that we're giving, that we've made available. We're able to support, which I think is great, but there still is a bit of that underlying message. And that is part of the work that we're doing here as well, is getting people to think differently when we talk about mental health. And I think a lot of times it starts with just defining what is mental health, because most times people think illnesses, depression or anxiety. I don't have mental health. Well, we all do, because it's that overall part of being healthy. And we talk very much about that holistic model, and we talk about health on this project is about physical, mental, and social well-being, not just the physical. So what are you doing on a day-to-day basis to take care of all of that? And we talk around health being that inclusiveness and really trying to build that message.
And do you find it's really important to train your managers to recognize and respond to those stressors?
Mm-hmm. I think there's a couple of things that often fall into place. Sometimes as we see people making it out bigger than what it needs to be. Well, what, I don't know how to fix this. I don't know what's wrong with them. And we say, it's not your job. We're not asking you to diagnose. We're not asking you to fix it. We're not asking you to make it better, because depending on what's going on for the individual, they may not be able to do it. We actually have a training program here for supervisors, and we say all we're going to do is teach you is what to look for, what to be aware that might indicate that you have a staff member struggling. How do you approach them and have that conversation? And then how do you link them to the supports that we have on site? That's all we're asking you to do. But then there's also still sometimes that underlying fear. What if I do the wrong thing? What if I say the wrong thing? What if I make it worse? And again, it's about understanding what your role is. And it isn't, I would say this, at the simplest, what would you say to somebody that was angry? What would you say to somebody that was sad, right? What is the emotion you're seeing? How do you respond and support that with some direction where to get them where you want them to go? And then just normalizing it, expressing, maybe your own vulnerabilities, letting them know that it's okay, that they can come and talk to you if they're struggling at home, or if they're struggling to say on task, or if they need to come in and see the counselor, that's okay. The same as if you twisted your ankle, were unable to work today. If your anxiety is up and you're unable to focus, we want to keep you safe. So maybe you need a day back at camp, or you need to pop in and talk to the counselor, and that's absolutely fine.
Yeah, and I think the thing that the terminology that you use so often when we talk about the program is conversation. You're always talking about talking. And I think that just makes it more normal and normalizes mental wellness the same as physical wellness. I think, too, you do a lot of work around educating what's empathy versus sympathy.
Yes. Absolutely. I'm a huge Brene Brown fan.
Yeah.
I don't think you can work the years in healthcare that I have and not become a Brene Brown fan. But yeah, talk about that, and again, that position of vulnerability, even within managers, if you haven't been through an experience like this yourself, just that connection, maybe you've experienced loss somewhere else, or maybe you've experienced disappointment, or maybe you've been under high degrees of stress. What did that feel like for you, so that you have that understanding of what it would feel like for somebody else?
Yeah, we're all people. We all have life, right? We all experience the same things. What would you say organizations need to consider when establishing well-being programs for employees working on-site and or in remote locations?
I think there's a few things. For us, one of the big challenges was we didn't want to come in and sort of be an offset. Like, we didn't want to come in and sort of be, okay, well, we're going to talk everything. Oh, by the way, here's mental health.
Like a random act of wellness, kind of over there down the hall.
Yeah. When I have time, when I think about it, when I'm not busy, then I'll take care of my mental health. So we really worked hard in fitting into the existing culture here. We actually joined the HSSE team here on site. So we are part of the overall health and safety team here. And so it was a great fit for us.
That's so pivotal, because health and safety is the number one commitment by the people on site. So then it's part of being the culture of normalizing wellness.
Yes. It was interesting. A couple months ago, I was out doing a training with some supervisors, and, I was getting a little bit of pushback, and I'm okay with that. And that's fine. I always say, challenge me. Let's talk about it. Let's, let me help change maybe some of your opinions around this. I'm up for it. And it was really interesting because somebody else in the room stood up and he said, he said, when our fathers worked in this construction and building, they didn't wear hard hats. They didn't do safety glasses. He says, but they brought that in, and that was their change to the safety culture. And he said, in our generation, it's the FLHAs, and it's the job assessments and the risk hazards. That's what we brought in. He said, and this new generation, they're bringing the psychological safety into the workplace. Every generation has done something to change and make the workplace better. And he said, psychological safety is the new thing that they're doing to make us all safe. Right. And I thought that was I'm like, that is brilliant. I'm totally going to steal that and use that. And I said, I agree with them 100%. We are talking more and more about it and morphing it into that aspect and fitting it into the existing culture. Right. And really it's about our goal is from the moment that you get onto the LNG Canada project, you are introduced to mental health. Mental health is talked about from the welcome packages that we send to the orientation, to the visual onboarding center. Mental health is part of the culture here. So it's not an afterthought, it's embedded, and we're really making sure that message is held. We have, information cards in rooms and posters, and it's just simply, if you need to go to the clinic for a physical injury or concern, you can go to the counselor's office for a mental injury concern. Again, very, very much. And I think one of the things that we're really focusing on here as well is that we're making sure that there's support for families. And I often say this because as difficult as it is for us to be away from home, it's difficult for our families as well when we're away. Sure. So, for me, when our children were younger, my husband was a camp worker, so he was away from home. It was very different. He talks about the two ATCO trailers in the middle of nowhere versus, I sometimes feel like I'm living in a resort. But, and I thought about that when I came here, but what were the things that myself and my kids would have liked to have known about my husband's environment? So we actually have a welcome package for families, that talks about what does Cedar Valley Lodge look like? What are they doing here? What are supports for them in terms of long distance parenting, healthy coping skills, all of those types of things. And of course we have the services that WPO offers, for families as well. And that I think we have to recognize if it's hard, if there's challenges at home, it makes it that much harder for our staff to be here. And it also puts them at risk, right? I'm not a fan of limits on counseling appointments, and so many EAPs and programs now, 6 is all you get. Yeah. Please don't do that. Because sometimes, you just need 1 or 2, but sometimes you need longer ones as well. Yeah. We don't limit doctor's appointments, so why are we limiting counseling appointments? Again, that idea, this holistic model that is all one and the same. And yeah, I think just incorporating that message, I always say, as much as we, and we need the physical first aid, I would love to see mental health first aid as required on a work site as much as physical first aid is. So just really raising it to the importance that it should be at, incorporating it in that holistic message around health, and making sure that there's training programs, that there's opportunities. We're building a peer support program here as well. And again, just being able to meet people where they are when they need it is one of the best things we can do.
Yeah. And, it was so impactful for me to just feel the life there. And I thank you for having me as your guest on site. But, I don't even think that you're doing yourself a complete justice of all the incredible things that you have on site. I mean, from the safety talks, from medication, physical health is there's an emphasis there. Absolutely. Every tool is available from a physical health perspective, but same too is everything available from a mental health perspective. I mean, there's kilometers and kilometers on that site, and the wellness team are out there, doing safety talks. They're out there, checking in with people. You know, even your interaction with 3,500 people, the amount of people that knew you and said hello when we were walking around was just incredible. You've done an incredible job.
Thank you.
I
always laugh and say I'm a little passionate about this stuff.
Well, I mean, we kind of talked about this, but is there anything else you think that workers need to have timely, adequate access to mental health support that we haven't talked about today?
I think the only other thing would be treatment programs. You know, if there's a way to help fast track into treatment programs, would be so valuable. We see such risk around that. You look at some of the numbers that are out in different communities. We know that it's impactful and it becomes a barrier. And I think again, it's, I come from a world of crisis management and looking at sort of the aftercare piece, training skills, recognizing that type of thing. And I think one of the big things that we've done here is when you look at the educator that we have on site, he comes from that preventative, the mindfulness, the meditation. And I think that's really important for us to be looking at. It's not just about when somebody gets ill or when somebody needs the services, but what are we doing in terms of, I mentioned for those protective factors, right? What are we doing around, we work very closely with the social recreational team here at Cedar Valley Lodge. We have support groups on site. So we have dog visits. We have locals that bring in their dogs. We've got,
I love that. And too bad there were no dogs there when I was there because I needed a puppy cuddle.
Yeah, it's great. We also have NA. We have AA. We have a women's support group. We have a men's support group. We work with local churches to get services in town. And here on site. But you're right, we go out to toolboxes. We have a designated toolbox once a week to mental health. Myself or Greg, the educator, we're out quite often. We speak at safety meetings, and then we have a whole host of programs available. We do company orientations. We always just say, let us know what you need and we'll make it work for you. And we love to talk. I mean, that's where it comes down to us. They give us a platform to talk and we'll come and talk about it. And sometimes it is, about the skills and it is about developing that resiliency and, informally teaching some CBT skills, to how can you reframe, how can you refocus. We do, we had a big display table and some videos around Bells Let's Talk. We just filmed a video with one of our contractors last week for the bullying harassment, the Pink Shirt Day that's coming up. We do events on site for Mental Health Week, Suicide Prevention Week, and again, just building that into the culture.
Yeah. Yeah. And there's something to be said for just, one-to-one and humanizing and seeing people in the flesh. But you've really built a culture of all types of supports and access available. You've got a phone, you've got a drop-in, you've got the app, you've got the orientation. I mean, the fact that there's an orientation for all new people on site, an orientation booth that you attend or someone from the wellness team attends and talks about as they move on to, safety on site and so forth. It's really woven within your culture, and you are just doing an incredible job. I think we're just a little over a year and a half now of the program, and the work that's been done in the last year has just been incredible to be a part of and to watch and see. And I thank you so much, Mary Lou, for today's interview.
It's been a blast. I look forward to continuing working with WPO. It's been fantastic working with all of you and creating this wonderful new plan that hopefully somebody, every construction site, every major remote site will have a program like this and support their workers' overall health. They say it's not about physical health anymore. Here's my challenge to everybody that's listening. because this is the challenge that I make to everybody that comes on site. I want you to talk about, think about, and protect your mental health in the same way you do your physical health.
Perfect. Thank you.
You're welcome.